OSHA stands for the Occupational Safety and Health Administration. They're a branch of the United States Department of Labor, and they ensure safe and healthy working conditions for employees by enforcing standards. These standards cover all kinds of safety concerns, but for our purposes, we'll be focusing on how they relate to hazards found in healthcare and dental facilities. This is your OSHA manual. You either have our red OSHA book, like this one, or one similar to it. These are your safety policies, and they include bloodborne exposure control, hazard communications, biomedical waste management, TB infection control, and general compliance, like your fire plan. Although most of you probably won't, it's your right to access this policy anytime during business hours, so you should know where it's kept. Since we're conducting training for healthcare and dental personnel, there's some serious topics like potential exposure to bloodborne pathogens and chemicals. But honestly, most of this is common sense. You have an employer that wants to have a safe workplace, so if you have a safety concern, let somebody know about it. By the way, that somebody is your safety and health officer. In a large facility, it might be a dedicated position, but in most cases, it could be your doctor, office manager, nurse, supervisor, or any other designated employee. They're the person to see if you have an injury or safety concern, so it's important to know who they are. Keep in mind, your employer has the responsibility to provide a safe workplace, but you have a responsibility too, and that's to follow these policies and to report unsafe work conditions. This is the federal OSHA poster. You should have it or your state's equivalent posted somewhere in your facility. It's a summary of the Occupational Safety and Health Act of 1970, and it conveys your rights and your employer's responsibilities. It's often found in places like an employee break room and displayed with other required labor law posters. There are some companies that sell these labor law posters in a laminated, multi-poster format, and although they're convenient, any posters that are actually required to be displayed in your facility are available for free. You can visit your state's Department of Labor website to request copies or to see what postings are actually required. Workplace violence, fires, natural disasters. Although they're unlikely, OSHA requires you to have contingency plans for anything that could potentially impact your safety. What is workplace violence? Workplace violence is violence or the threat of violence against workers. It can occur at or outside the workplace and can range from threats and verbal abuse to physical assaults and homicide. You may never encounter aggressive or violent people where you work, but you should think seriously about the risk that something could happen. If you find yourself thinking it can't happen here, you should reconsider. Violent acts often happen when employees are performing their normal duties. In some occupations, dealing with dangerous people comes with the territory, like a police officer, a correctional officer, or a mental health care worker. For the rest of us, though, a violent reaction by a patient or a visitor would be unexpected, triggered by an argument, pain, anger at the quality of service or denial of service, delays, or some other precipitating event. Employees experiencing the largest number of these types of assaults are those in healthcare occupations, nurses in particular, as well as doctors, members of emergency medical response teams, and hospital employees working in admissions and emergency rooms. But any healthcare setting, medical or dental, has the potential for violence. Workplace violence usually falls into one of three categories: disruptive, threatening, and violent behavior. Although disruptive behavior doesn't constitute physical violence, it can escalate into a serious situation if it's not dealt with in an appropriate manner. Try to diffuse the situation. Respond in a calm, quiet manner. Try not to take the behavior personally. Don't challenge or dare the person. Usually the dispute has little to do with you, but you're used as the target. Ask questions and try to assist them or offer an apology, even if you haven't done anything wrong. If this isn't working and the individual doesn't seem dangerous, calmly and firmly set limits. Ask the individual to stop the behavior and warn of official action. If they continue to carry on despite your warnings, direct them to leave the building. Sir, we've tried to help you, but you're continuing to make threats. Please leave the building or we'll call the police. Finally, if you have to talk to someone and they seem dangerous, make sure you have co-workers nearby. Never isolate yourself. Still try to maintain a calm, non-confrontational approach to diffuse the situation, and never touch the individual. Even a gentle touch may be interpreted as an assault by an agitated person. Although a fire is unlikely, it's important to be prepared. If there is a fire, pull the fire alarm or call the fire department or 911. In most cases, your policy is to evacuate. You should be familiar with the locations of stairwells and exits. Identify and use the safest route to evacuate your building. Unless you've had specific training and been designated to use a fire extinguisher or help with patient evacuation, your policy is to evacuate immediately and meet at your predetermined assembly area. But if it's a small fire and you're not afraid, fire extinguishers can be very effective when used properly. Most fire extinguishers operate using the following pass technique. Pull the pin. This will also break the tamper seal. Aim low, pointing the extinguisher nozzle at the base of the fire. Squeeze the handle to release the extinguishing agent. Sweep Sweep from side to side at the base of the fire until it appears to be out. Once again, OSHA is about employee safety, so ultimately it's about your safety. If you have the slightest doubt about your ability to fight a fire, evacuate immediately. A tornado, a bomb, a threat in a nearby building, chemical spill, active shooter, a terrorist hit. All things that are unlikely but unfortunately a possibility. Situations where, unlike your fire plan, staying put is your best option. A shelter-in-place plan is used when there's an emergency where chemical, biological, or radiological contaminants may have been released into the environment, and it's best to remain indoors. Such releases may be the result of an industrial accident or an act of terrorism. Should this occur, information will be provided by local authorities on TV and the radio. In the event that a shelter-in-place is advised, the best thing you can do is remain indoors. Windows and doors should be closed and locked. And most importantly, all air handling equipment should be shut off so the outside air isn't brought into the building. Emergency supplies might include a portable radio, food, water, flashlight, and plastic sheeting to seal vents and windows. Keep in mind, the shelter-in-place supplies are only a recommendation, though. You also have policies that address natural disasters based on your geographical location. For instance, areas that are prone to earthquakes and tornadoes should have policies that designate rooms or areas that would be the safest during the event. Some natural disasters, like hurricanes and blizzards, are somewhat predictable and allow time to alter business hours or shut down if necessary. Every year, it seems there's some new gadget, computer peripheral, or some other piece of equipment that allows us to perform our duties faster and more efficiently than in the past. Unfortunately, additions come at the cost of more power consumption. RPT stands for relocatable power taps. We know RPTs as power strips or strip plugs that allow us to expand a standard outlet to accommodate more devices. If used correctly, they're fine for low power items like computers and peripherals. However, some equipment and small appliances like lathes, model trimmers, coffee makers, electrical surgical units, space heaters, and vacuums like formers and evacuation systems can all draw loads over 5 amps and are considered high current loads. Pay attention to the load put on the source outlet. Regardless of the capability of the power strip, the wiring in your walls is only rated for the load of the original circuit. An overloaded circuit may cause wires to overheat, leading to insulation failure, arcing, and possibly fire. I just want to reiterate that the use of power strips and even extension cords are allowed if they're used correctly. It's never acceptable to daisy chain power strips or a power strip with an extension cord, or to remove a grounding pin from a 3-prong plug. When using potentially dangerous equipment to perform a function, it's important to follow the manufacturer's recommendations for safe use. Protective guards shouldn't be removed or modified. Some equipment, like lasers or rotary equipment, require additional personal protective equipment like eye protection. Finally, you have an employer that wants to have a safe workplace. If you're injured or have a safety concern, it's up to you to let someone know about it. Good communications is one of the best ways to stay safe on the job. If you have any questions about the safe use or required PPE for any equipment you use, see your safety and health officer. In order to reduce or eliminate the hazards of occupational exposure to bloodborne pathogens, your employer has established an exposure control plan as part of your OSHA policies. This plan describes the types of procedures you perform and what personal protective equipment or safeguards are required to keep you safe. OSHA's Bloodborne Pathogen standard requires your employer to provide employee training, hepatitis B vaccinations, PPE, and have engineering and work practice controls in place to keep you safe. So what are bloodborne pathogens? Bloodborne pathogens are microorganisms present in human blood and certain other bodily fluids. They include hepatitis B, hepatitis C, and HIV. The word hepatitis means inflammation of the liver. Although a number of illnesses and conditions like alcoholism can cause an inflammation of the liver, viral hepatitis is what we'll be focusing on. Viral hepatitis includes hepatitis A, B, C, D, and E. Hepatitis A and E are primarily spread by contaminated food or water. Hepatitis D is sometimes referred to as a piggyback virus and can increase the severity of acute and chronic liver disease in individuals already infected with hepatitis B. Hepatitis B and C are both bloodborne diseases and have the potential to infect healthcare workers. So let's take a look at these a little further. We already mentioned that hepatitis B is a risk to healthcare workers. It's spread through contact with the blood and bodily fluids of an infected person. Most adults who get it have it for a short time and then get better. This is called acute hepatitis B. Sometimes, though, the virus causes a long-term infection called chronic hepatitis B. Over time, it can cause severe damage to the liver. You can actually have hepatitis B and not know it. You might not have any symptoms at all. If you do, they can make you feel like they have the flu. Symptoms may include feeling very tired, mild fever, headache, not wanting to eat, feeling sick to your stomach or vomiting, belly pain, tan-colored stool, dark urine, jaundice, or yellowish eyes and skin. Jaundice is a late symptom and usually appears when the other symptoms are going away. Keep in mind, most people with chronic hepatitis B have no symptoms. Fortunately, there's a vaccination available for hepatitis B, and your employer is responsible for providing it at no charge if you have a risk of exposure to blood or any infectious materials. It's a vaccination series that's given in the deltoid muscle in 3 doses over a 6-month period. OSHA enforces the current CDC recommendations for healthcare workers that calls for a titer 1 to 2 months after the 3rd dose to confirm antibodies. The CDC estimates the vaccination is approximately 95% effective, thus leaving about 5% of individuals unprotected. These employees are considered to be non-responders. Individuals that are non-responders after the first series should repeat the series of 3 again, followed by another blood test to check for antibody conversion. The CDC only recommends a total of 6 doses or completing the vaccination series twice. If you still don't develop antibodies, you know that you're a non-responder and will never develop antibodies. But it's better to know you don't have protection against hepatitis B instead of assuming that you do. Some of you might have been vaccinated at a previous job or prior to the CDC recommendations, like myself. Employees that fall into this category and don't know your antibody status would be tested for hepatitis B, C, and HIV following an exposure incident. Employees that know they're immune will only be tested for hepatitis C and HIV. If you're at risk or have any questions about your facility's policy for hepatitis B vaccinations, talk to your safety and health manager. Hepatitis C is another bloodborne disease that's a potential risk to healthcare workers. It's especially dangerous because so many people are infected that don't know it. The CDC estimates that on average, 1 in 50 American adults are infected with hepatitis C. That number is even higher among baby boomers, people born between 1945 and 1965, with estimates ranging as high as 1 in 33. Baby boomers are at an increased risk since the blood supply wasn't screened prior to 1990. These statistics should really emphasize the importance of practicing universal precautions. If you haven't heard this term before, it's an approach to infection control that treats all human blood and certain human bodily fluids as if they were known to be infectious for HIV, hepatitis, or other bloodborne pathogens. Although there isn't a vaccine available to prevent hepatitis C, the symptoms are very similar to hepatitis B. Most people have no symptoms when they're first infected. If symptoms are present, they may include feeling very tired, joint pain, belly pain, itchy skin, sore muscles, dark urine, and jaundice. Once again, similar to hepatitis B symptoms in the fact that it appears late as other symptoms are going away. Most people go on to develop chronic hepatitis C but still don't have symptoms. This makes it common for people to have hepatitis C for decades before it's diagnosed. Human immunodeficiency virus, or HIV, is a virus that attacks the immune system, the body's natural defense system. Without a strong immune system, the body has trouble fighting off disease. Both the virus and the infection that it causes are called HIV. HIV might not cause symptoms early on. People who do have symptoms may mistake them for the flu or mono. Common early symptoms include fever, sore throat, headache, muscle aches and joint pain, swollen lymph nodes or glands, skin rash. Symptoms may appear from a few days to several weeks after a person is first infected. The early symptoms usually go away within 2 to 3 weeks. After the early symptoms go away, an infected person may not have symptoms again for many years. After a certain point, symptoms reappear and then remain. These symptoms usually include swollen lymph nodes, extreme tiredness, weight loss, fever, night sweats. PPE includes gloves, mask, eye protection, barrier garments, pocket mouth-to-mouth resuscitation, or other ventilation devices. In other words, whatever is required to protect you from possible exposure to bloodborne pathogens. Your employer has the obligation to make appropriate personal protective equipment readily available at no cost to you. The PPE must be fitted properly and address any personal requirements such as latex allergies. Remember, every facility's risk of exposure will vary depending on the types of procedures you do. Your safety and health manager has determined the minimum required PPE for the tasks that you perform at your facility. This page is located in your exposure control section of your OSHA Guard manual. This is the schedule of minimum required PPE for the tasks you perform. You can always exceed the minimum PPE requirements if you like or feel more comfortable wearing more. If you have any questions about the location or availability of PPE, talk to your safety and health officer. Engineering controls are mechanisms that isolate or remove a hazard from the workplace. The original bloodborne pathogen standard wasn't specific regarding the applicability of various engineering controls in healthcare settings. The standard was revised in 2003, and it now specifies that safer medical devices such as sharps with engineered sharps injury protections and needleless systems constitute an effective engineering control and must be used where feasible. This is a relatively new term, and it includes non-needle sharps or needle devices containing built-in safety features that are used for collecting fluids, administering medications or other fluids, or other procedures involving the risk of sharps injury. This description covers a broad array of devices, including syringes with a sliding sheath that shields the attached needle after use, needles that retract into a syringe after use, shielded or retracting catheters, retractable safety scalpels, needleless systems. The use of these safer alternatives must be evaluated annually and implemented if appropriate. All employees that have contact with needles should be part of the evaluation process. This would include individuals that actually give injections, but would also include any staff member that handles or disposes of needles as well. Many factors need to be taken into consideration when evaluating safe needles. Most importantly, it should be safer than what you're currently using, and it shouldn't make the procedure more difficult. In the back of your OSHA Guard manual, you'll find a form to document any safe needles you or your staff evaluates. This form asks basic questions that will help you determine if the safe needle or device is appropriate for your use. The safety device can easily be activated with a one-hand technique. The device is easy to handle while wearing gloves. The safety feature doesn't cause more patient discomfort. The design of the device allows for easy removal and changing of needles if required. These are just a few of the questions that will help determine if a device is appropriate for you. Be sure to document any safety devices you try. OSHA expects you to implement the use of safe needles or other medical devices if they're appropriate for your needs. If you aren't using safety needles, use the form to explain why they're not appropriate for your use. This must be an ongoing process. Evaluations have to be documented at least once per year. Technology improves, so make sure you ask your vendor reps for any samples of the latest safety needles available. Although safety needles are a great way to reduce the likelihood of exposure incidents, they're not always appropriate for all procedures. If you aren't using safety needles, it's important to use a combination of work practice and engineering controls to reduce the possibility of exposure. That means not recapping if you don't have to. Disposable needles, syringes, blades, broken instruments, or anything that might lacerate skin should be immediately discarded into a sharps container after use. Contaminated reusable sharps should be placed in a puncture-resistant, leak-proof container. The container should be identified as biohazardous until the items are properly sterilized. In some specialties, like dentistry, recapping a needle is unavoidable. If you have to recap a needle, a recapping device is a great way to prevent needle stick injuries. They're a mechanical device that allows the user to recap but keeps their hand safely away from the hazard. The single-hand scoop method is okay, but facilities should consider implementation of a safer mechanical method. Under no circumstances should needles be recapped using a hand-to-hand method. No matter how careful you are, accidents can still happen. If you have an exposure incident, you have the right to immediate medical attention. If you're stuck by a needle or other sharp, or get blood or other potentially infectious materials in your eyes, nose, mouth, or broken skin, immediately flood the area with water and clean any wound with soap or a skin disinfectant. Report the injury to your safety and health officer and seek medical attention immediately. These forms are used to document exposure or sharps injuries in your workplace. They should be completed as soon as possible after an exposure incident. These forms are important. They document the exposure, allowing management to implement change if necessary to avoid a similar accident in the future. But it also provides permanent documentation in your employee medical record in case there's complications down the road. Remember, if you have an exposure involving blood or other infectious materials, you have the right to immediate medical attention at no cost to you. You have a legal obligation to ask the source patient, if known, to consent to a blood test as well. Ideally, both the exposed employee and the source get tested. If the source's patient's blood comes back negative, that's the extent of testing, and the employee has closure and peace of mind, usually within 15 days. If the source is unknown or refuses to test, testing is normally carried out over a 6-month period. This includes the baseline and then a follow-up at 6 months. OSHA currently enforces whatever the CDC recommends for post-exposure prophylaxis. If you have any questions about your facility's protocol for exposure incidents, talk to your safety and health manager. The Hazard Communication Standard was originally published in 1983, and until recently it's seen little change. In March of 2012, OSHA adopted portions of the United Nations globally harmonized system of classification and labeling of chemicals, or more commonly known as GHS. This alignment with our Hazard Communication Standard wasn't immediate. OSHA allowed a 4-year phase-in plan. The purpose of the Hazard Communication Standard has remained the same since it was first enacted, to provide workers with the right to know the hazards and identities of the chemicals they're exposed to while working, as well as the measures they can take to protect themselves. Although we've had change, the basic requirements for compliance haven't. You should be familiar with the chemical hazards in your facility. This is accomplished through safety data sheets for all hazardous chemicals, properly identified containers with warnings, and employee training. In the past, manufacturers used either the NFPA or HMIS rating systems. These systems used a combination of colors to identify the types of hazard and numbers to convey the severity of these hazards. With the alignment of our hazard communication standard with GHS, the previous rating systems have kind of taken a back seat to the new required elements. GHS requires much more information to be conveyed. Hazards are expressed with a combination of pictograms, a signal word, and hazard phrases. The new standard requires pictograms on labels to alert users of the hazardous chemicals to which they may be exposed. Each pictogram consists of a symbol on a white background framed within a red border and represents a distinct hazard. The pictogram on the label is determined by the chemical hazard classification. You should be familiar with the 9 pictograms used with GHS. Flame, exclamation mark, health hazard, skull and crossbones, corrosion, flame over circle, gas cylinder, exploding bomb, environmental hazard. Signal words are used to indicate the relative level of severity of the hazard and alert the reader to a potential hazard on the label. There are only 2 words used as a signal word: danger and warning. Within a specific hazard class, danger is used for the more severe hazards and warning is used for the less severe hazards. There's only 1 signal word on the label, no matter how many hazards a chemical may have. If one of the hazards warrants a danger signal word and another warrants the signal word warning, then only danger should appear on the label. The Hazard Communication Standard requires manufacturers and distributors to provide safety data sheets, or SDSs, that contain detailed information about a chemical's hazardous components, physical and chemical characteristics, and safe practices for using it. These safety data sheets were previously referred to as MSDSs, or Material Safety Data Sheets, prior to the alignment with GHS. Under the updated Hazard Communication Standard, manufacturers and distributors had until June 1, 2015 to prepare SDSs in a uniform 16-field format. Although MSDSs required the same information, it wasn't required to be in any said order. The new standard requires section numbers, headings, and associated information in the following order. Section 1, Product Identification. Section 2, Hazards Identification. Section 3, Composition and Information on Ingredients. Section 4, First Aid Measures. Section 5, Firefighting Measures. Section 6, Accidental Release Measures. Section 7, Handling and Storage Lists. Section 8, Exposure Controls and Personal Protective Equipment. Section 9, Physical and Chemical Properties. Section 10, Stability and Reactivity. Section 11, Toxicological Information. Section 12, Ecological Information. Section 13, Disposable Considerations. Section 14, Transportation Information. Section 15, Regulatory Information. Section 16, Other Information. Although manufacturers and distributors were required to comply in June of 2015, workplaces were given an additional year till June 1, 2016 to acquire these SDSs. Safety data sheets can be requested from the manufacturer from distributors like Shine or McKesson. The internet's a great resource too. A simple keyword search like Cavicide SDS 2016 can produce great results. If you haven't yet, it's important to update your old MSDS book. The easiest way to tell the difference between an MSDS and an SDS is the title and the information found in Section 2, Hazards Identification. GHS information is easy to spot by identifying the pictograms, signal word, and other GHS information required on any hazardous chemical. Your SDS book should be orderly and have a master list that lists all the hazardous chemicals in your facility. Like always, employers must ensure that SDSs are readily accessible to employees. Manufacturers use labels to identify their products. Although they're unique in their own way, they have one thing in common. They identify what their product is, who manufactures it, and any hazards associated with it. Typically, if a product's in its original container, you don't have to do any sort of labeling. However, products that are removed from their original containers, like isopropyl alcohol, cold sterilization, or trade cleaner, must be identified and include the following information to be compliant under the Hazard Communication Standard aligned with GHS. Product name, pictograms, signal word, hazard statements, precautionary statements, and manufacturer information. Product name, manufacturer information, pictograms, and the signal word are pretty straightforward and should be identified as they are on your product's SDS. Hazard statements and precautionary statements can be lengthy and include a lot of information. There is some flexibility though. Hazard statements should be worded exactly as they are from the manufacturer, but statements can be combined where appropriate to reduce redundancies and improve readability. Precautionary statements, on the other hand, are somewhat subjective. They can be omitted, shortened, combined, or used in a manner that communicates the best way for an employee to protect themselves. So here's a secondary container that we'll be soaking instruments in. This is a perfect example of when you would need a label to be in compliance. Since we're removing the product from its original container, we need to identify it and any hazards associated with it. To do that, we need to get the SDS. Here's the SDS for Cavicide. We found it filed under C in our SDS book, and we'll use the information to create a GHS compliant secondary label. Remember, we're only doing this because we're removing the product from its original manufacturer's packaging. As we previously discussed, label elements can be found in section 1 and 2 of your product's SDS. We obviously know that the product in this case is Cavicide. We can find the signal word and pictograms in field number 2, hazards identification. A hazard must be expressed for each class of hazard. In this case, the product should be identified as flammable and an irritant. OSHA also allows the use of placards and backsplashes to communicate hazards as well. This can be especially useful in a situation where you have a product in a number of small bottles or containers. The hazard should be identified in the immediate area. The corresponding bottle should be labeled with the product name if possible and associated with the warning. We're using colored dots to identify our bottles with the corresponding placard. This should only be used if traditional labeling isn't possible or practical. Biomedical waste, infectious waste, medical waste, regulated waste, a waste that presents a threat of infection to humans. Doesn't matter what you call it, you just want to be careful when you handle it. Although OSHA does provide some guidance, the majority of the regulations pertaining to the disposal of biomedical waste falls at the state level. OSHA's guidance is more geared towards the segregation of medical waste at the generating facility. The Bloodborne Pathogen standard, and pretty much every other state, define regulated waste as liquid, semi-liquid blood, or other potentially infectious materials. Contaminated items that would release blood or infectious materials in a liquid or semi-liquid state if compressed. Items that are caked with dried blood or infectious materials and are capable of releasing these materials during handling. Contaminated sharps, pathological and microbiological waste containing blood or other potentially infectious materials. OSHA's standard requires that contaminated sharps are disposed into appropriate containers at the point of origin or as close to the area where the item was actually generated. They specify that containers must be closable, puncture resistant, leak proof on the bottom and sides, and labeled or color coded biohazardous as specified by the standard. These sharps containers are for spent needles, carpules, blades, glass slides, or any other contaminated sharp item when they're contaminated with blood or OPIM. It's important that they're assembled correctly. Lids should be securely fastened to the container with the opening orientated to the correct side and the biohazard symbol and fill line visible. Wall-mounted sharps containers should be firmly anchored to the wall and mounted at a comfortable height for all users. This is the fill line. Under no circumstances should this line be exceeded. When a container gets close, it should be sealed at the point of origin and replaced. The full sharps container should be brought back to your final destination storage area or removed with your next pickup. Regulated waste that's not considered a sharp should be disposed of into a red bag. These red bags are specially designed to be leak, tear, and puncture resistant and are identified with the biohazard symbol. Just like sharps containers, they should be easily accessible and located in the areas where the waste is actually generated. Red bag waste typically includes items that are saturated with blood or other potentially infectious material, regardless if they're absorbent or non-absorbent. Waste includes gauze, dressings, cotton rolls, and visibly contaminated gloves and IV tubing. Although a spill of blood is unlikely, it's important to be prepared. Kits are available, but most facilities probably have adequate supplies on hand. Most spill kits include supplies like gloves, red bags, absorbent material, bleach, disinfectant, safety glasses, forceps or a small broom and dustpan. Blood spills can vary depending on the volume and type of contact surface. A small amount of blood, if splashed, can cover a large surface area. A large spill, if undisturbed on a flat surface, can pool in a relatively small area. If there's a spill, the following steps should be taken. Evaluate the situation. Select and wear appropriate personal protective equipment. Gloves might be okay for a small spill, but if there's a likelihood of splatter or splashing, additional PPE would be required. Remove any sharp objects like broken glass or needles. Never use your hands. A mechanical method like forceps or hemostats is the safest way. Cover the spill with a bleach solution or a hospital-grade disinfectant, depending on the surface, and let it sit for the appropriate contact time. Put an absorbent material like paper towels or kitty litter over the spill area. Clean up the absorbent material and discard in a red bag. Your gloves should be removed and replaced at this time. The area should be cleaned with warm soap and water or an all-purpose cleaner. Spray a hospital-grade disinfectant on the area and allow to sit for the recommended contact time. Finally, dry the area with paper towels and discard the cleaning materials and gloves. Wash your hands thoroughly. Tuberculosis is an airborne disease that may present a risk to some healthcare workers. Your degree of risk is dependent on a few factors, including the prevalence of TB in your community, the number of cases treated in your facility, and the types of procedures you actually perform. The majority of medical and dental facilities would be classified as low risk. If your facility doesn't admit or treat patients with active TB, you're not required to have specific engineering controls in place. However, it's always a good idea to have a small supply of specialized personal protective equipment, like a box of N95 respirators, in case you suspect a potentially infectious patient. Although your risk is low, it's important to be familiar with the symptoms of active TB. The symptoms include a prolonged cough that lasts 3 weeks or longer, many times producing bloody sputum or bloody phlegm, fatigue, fever, night sweats, chest pain, weight loss. If a patient admits having active TB, or you suspect that they might be infectious, they should be referred to a local admitting facility that is equipped to deal with TB. Treatment should be deferred until the patient is no longer infectious. Some larger facilities, pulmonary and infectious disease specialists, and any other specialties that admit and treat patients with TB obviously have a higher risk of exposure. These facilities would be obligated to provide routine testing, specialized personal protective and fit testing on a routine basis. If you have any questions about TB, site-specific policies, or testing, talk to your safety and health manager. Well, this wraps up your OSHA training, and like we mentioned earlier, most of this stuff is common sense. You have an employer that wants to have a safe workplace. If you have any safety concerns, if you have any questions about your policies, make sure you talk to your safety and health officer.